and thank you again for joining us on another episode of TeraRecon's Tales from the Taxi Line. My name is Renee Stacy, and I am the Director of Product Marketing here at TeraRecon, and I'm really happy to be joined tonight by Dr. Giovanni Lorenz. He is a cardiothoracic radiologist for the San Antonio Military Health System. Welcome, Dr. Lorenz, to the line.
Thank you, Renee.
I'm so glad you knew what the taxi line was. So that's awesome. So, Dr. Lorenz, not only have you certainly been a great friend and supporter to TeraRecon, but you have been very active supporter of RSNA, especially this year with the virtual event. I'm interested to know what your hopes and expectations were for this year's conference. And now that we're really almost finished the week of this virtual event, what's been your experience this week so far?
Yeah, well, I mean, I can tell you one thing, Renee, that I think we're on day 4 right now. I'm just blown away by the content. RSNA pulled all the stops and they brought in every single high-end rock star individual in the subspecialty fields in radiology, imaging, artificial intelligence. And the vendors came specifically to present that type of information too. So you have this huge consolidation of the most amazing imagers, the most amazing clinical scientists, and then vendors to support this one beautiful thing, which is artificial intelligence, high excellence imaging, and we're still able to deliver it even on a virtual platform. And I think we were talking about this before we started here, but how amazing is it that, you know, in literally a couple months, we are able to deliver this entire thing, you know, virtually for over 23,000 people, I think was the last count. I mean, this is amazing. And for me, having at prior conventions missed that first 5 minutes, you know, because you grabbed another cookie or got a coffee or something like that, and you're like, oh, what? But here you can actually not miss it. I mean, you can still get your cookie and eat it too, right? Because you could just click play, right? And get going. It's absolutely amazing. Yeah. I love RSNA. I mean, they've just always done a great thing. So yeah, I mean, the content is here.
And exactly, like, so I've noticed, you know, going every day, I'll go into the RSNA in the programs and, you know, see what's kind of on coming up on plate, and just the quality of the content. I'm just daily, I'm amazed at, and you know, love the ability that we can kind of go back and rewind and really look at this information. It's really been, I think from an attendee perspective, certainly a very valuable conference this year, probably more so than in many years. I mean, of course, the exhibit experience is probably a lot different, and that's okay. I mean, different's fine. But, you know, from a quality perspective, I can imagine that yourself and your peers who are all attending this show are probably pretty happy with that content as well. So
yeah, there's no question that the quality is constantly at the highest level at RSNA. And now in this format, you have the ability to flex, to add things in whatever program format that you can fit into. So for me, I mean, I was working trauma schedule yesterday and the day before and put in a few meetings, was able to sit in for the special interest sessions on health disparity and equity, and then the artificial intelligence disparity conference. So, I mean, these are amazing, amazing opportunities. And to think that I can sit in and see those things happen while, you know, working in the trauma bay. I mean, this is amazing.
Yeah, it's really the best of both worlds, and you're not getting cold and your feet aren't sore. So that's really the win-win, right? So, So speaking of really excellent and amazing content, of course, you are also on the program at RSNA as part of the AI showcase. TeraRecon was very pleased to sponsor you in that activity. I know that we have received a lot of very positive feedback on your presentation. I expect that RSNA has probably received the same. There's probably some folks who haven't had a chance to take a look at it. Of course, the title of your presentation is Take Heart. I'd like you to just take maybe a minute to give us a little bit of a highlight reel, let's call it, of your presentation, because I think it's a very worthy presentation. I would hope that all of your colleagues and peers will have an opportunity to watch it. So why don't you give us a kind of the short version.
Sure, absolutely. So Take Heart is essentially how the military processed 35,000 basic military trainees and the cardiac problems, opportunities that arose during COVID, and how we leveraged our advanced visualization, our artificial intelligence, smart IT, and radiologists to make that actually happen. So this is not a one-person solution. This was actually everybody, vendors, including TeraRecon, to come together and make this happen. And you know, we used everything. We used echocardiogram, CT, cardiac MRI. We used telerad, telereporting, artificial intelligence in our algorithms to actually make this happen. So I would urge you all, if you haven't seen it yet, you know, maybe take the first 2 to 3 minutes to see if it bites, and then send me an email and we can talk about it more.
Yeah, absolutely. So, you know, folks who are looking to see this, certainly you can go up onto the RSNA website where they've got all of these great presentations that are easy to access. It's also available on TeraRecon's website, and we'll be there for the next little while as well. So it's super easy for folks to take a look at that at their leisure, like you were saying. So work it into their day, which is great. So I think that's all we have for tonight. I just wanted to say thank you so much for joining us. Actually, I do want to remind everyone that you will be participating in a follow-on webinar to that presentation that'll be coming up soon, and there's going to be more information available to that, so people should watch out for that. And right now, we're going to sign off, and I'm going to say have a lovely evening. Thank you so much for your time. We really appreciate it, and so glad to hear this really positive feedback about RSNA. I think it's an important year, and I think the pivot has just really been done beautifully. And you know, I think everyone should be really proud of what they've been able to accomplish. So thank you very much and have a lovely evening.
Thank you, Renee. Take care.